On this Monday night, Canada's largest province reports a record number of COVID-19 cases. The rising numbers in Ontario spark a renewed plea.
We can avoid the worst.
And in Quebec, new cases trigger an elevated alert, the new rules in the red zone. Ottawa's modified proposal for paid sick leave, how millions more Canadians could benefit. Tax avoider in chief, the U.S. president on the defensive after his tax returns are exposed.
The IRS does not treat me well.
Will the revelations have any impact on the presidential race? And Canadian competition for the common good.
Our first and foremost priority right now is healthcare workers and frontline workers.
The race to create more PPE.
Global National with Donna Friesen.
Good evening and thanks for joining us. Tighter public health restrictions are coming to millions of Canadians as COVID-19 cases keep rising in parts of the country. In Quebec, 3 hotspot regions, including Montreal and Quebec City, are now on red alert. That's the highest level in Quebec's COVID-19 alert system.
The situation has become critical. The number of cases is rising. If we don't want our hospitals to be submerged, if we want to limit the number of deaths, we must act strongly right now.
Starting on Thursday, the 3 regions will be partially locked down for 28 days. Schools will stay open, but gathering places like casinos, libraries, bars, and restaurants will be closed. Only takeout will be allowed. As well, people are not allowed to have guests in their own homes, apart from a few exceptions. Here's why. Quebec has the most new cases reported in Canada today, 750. In Manitoba, where 39 new cases were reported today, new code orange restrictions are now in place for the Winnipeg area. That means mandatory masks in most indoor public spaces and a 10-person limit on gatherings indoors and outdoors. And in Ontario, 700 new cases were reported today. That is the most in a single day since the pandemic began. We will get to Ontario in just a moment, but first to Quebec, where Premier Legault held a news conference late this afternoon to explain that red alert and the new restrictions. Global's Felicia Perillo is in Montreal. Felicia.
Well, Donna, late today, the Premier announced that regions in red zones, the visits to other people's homes have been banned, as well as bars, casinos, movie theaters, and restaurant dining rooms. Masks will also be mandatory in outdoor situations where 2 meters isn't possible, including protests. Now, as you can imagine, this type of confinement is bringing up some anxiety for some people.
The dining room at Jukebox Burgers is quiet. Customers are few and far between, which has been the case since reopening back in June. The owner says another shutdown would be devastating.
Being an operator, I can adjust employees, payroll, purchasing, but I can't the rent. And good luck now going back to the landlord and saying, hey, there's going to be a lockdown for 28 days and can I reduce rent? They're going to, blow you away.
Montrealers are anxious to know how the new restrictions will affect them.
I manage sports installations, arenas. So when you tell me that, basically I'm thinking, hey, tomorrow we might be shutting down.
As for schools, though there have been outbreaks, provincial officials have said they would remain open even if a region moves to red.
It's an essential service. We can't go to work and do the family at the same time.
While hospitalizations and deaths across the province remain much lower than during the first wave, experts warn that those numbers could increase in the coming weeks.
As the number of cases goes up and as more and more people get infected, and if you start seeing outbreaks in the long-term care facilities, as we're starting to see now, that could change very, very quickly.
Dr. Christopher Labo says the good news is that we can curb the spread of a second wave if people limit their social interactions and stay home.
Now, I want to underline that most businesses in red zones are staying open, as are the schools. The Premier has said he hopes these measures will only last 4 weeks, but he says he won't make any promises. Donna?
All right. Felicia Perillo in Montreal. Thanks. Here's the number political leaders and public health experts are watching closely. With infections surging, the number of COVID-19 patients in hospitals in multiple provinces is starting to go up. In the last week in Ontario, the number of COVID-19 patients who ended up in the hospital nearly doubled from 65 to 128. The Ontario Hospital Association says drastic action is needed now. It wants parts of Ontario, the Toronto region, and Ottawa to return to stage 2. That would mean a ban on indoor dining and drinking at bars and restrictions on other non-essential businesses. As Eric Sorensen reports, that's not happening yet.
Barely a week after the Ontario government restricted the size of gatherings to no more than 25 outdoors, hundreds of people gathered in Wasaga Beach for a weekend car meet that included street stunts. Charges have been laid, but this may be just an extreme example of a failure to physically distance in a province with a mushrooming increase in COVID-19 cases. Monday's confirmed case numbers, 700, is the highest daily spike since the first wave of the pandemic last spring, and the recent trend shows a second wave is here. Plus, the Ontario Modelling Collaborative predicts the province will surpass 1,000 cases a day by mid-October. Ontario's premier says the second wave could be worse than the first.
We know that this wave will be more complicated, more complex, but what we don't know yet is how bad the second wave will be. The reality is, it's up to each of us.
End of summer socializing may be partly to blame. Young people account for most of the recent confirmed cases, but the percentage is falling for those under 40, suggesting cases among older and vulnerable populations are rising.
People have gotten very casual, I think, at the end of summer, early fall, and we've seen that effect.
Indeed, hospitalizations in Ontario have almost doubled in the past week.
But the most alarming feature is the fact that now we're seeing an increase in hospitalization usage. And with the increase in hospitalization usage comes ICU usage, comes ventilator usage, and eventually deaths.
The province says it'll spend $52 million to hire and train more nurses and personal support workers. But the Ontario Hospital Association also wants restrictions in and around Toronto and Ottawa to target bars and restaurants and gyms, theaters, and church gatherings. The province wants desperately not to shut down the economy again.
We don't want to turn back a stage unless we absolutely have to, but if we do have to, we will, because the most important thing is the health and well-being of the people of Ontario.
A second wave of COVID-19 was expected in the fall, but experts are surprised at the speed with which it's apparently arrived. Eric Sorensen, Global News, Toronto.
Toronto's top doctor is putting a pin in the idea of social bubbles. Dr. Eileen de Villa says people should avoid meeting anyone outside their immediate household.
There's an immediate rising risk in Toronto of continued and significant COVID-19 resurgence. What we need you to do is to think carefully about how to protect yourself as you go about your daily activities.
Alberta's largest hospital, Calgary Foothills Medical Centre, is restricting visitors as it tries to contain an outbreak of COVID-19. Only pre-approved essential visitors are allowed, along with those involved in end-of-life care. There are at least 53 infections in the hospital and 4 people have died. Across Alberta, cases aren't rising as fast as they are in Ontario and Quebec. As Heather Yurix-West explains, health officials say the province hasn't entered a second wave yet.
A month into the school year, parent Katrina Snow is feeling less anxious.
It seems to be going good, yeah. There's no cases. Kids are wearing the masks. It seems to be going very well.
At a time when several provinces have announced new restrictions, Alberta's chief medical health officer has lately struck a more hopeful tone. The threat of COVID-19 is still real, but in this province, Dr. Dina Hinshaw says a second wave has not begun.
But in Alberta, I don't think that that's where we're at right now. We have seen increased daily case counts for the last few months, but those have remained relatively stable.
While Ontario and Quebec have seen their numbers rise exponentially since the beginning of September, from less than 150 daily cases to 700 or more, Alberta has kept its case count relatively stable in the low to mid-hundreds for the last several weeks.
If we look at cities like Toronto or Montreal, they have 3-4 times the population density as, say, Calgary does. So we do know that more people in a small space, bad news for a virus.
But that's not to say things couldn't change quickly. Take, for example, the outbreak at Calgary's Foothills Hospital. Contact tracers are still trying to determine how the virus was able to spread so quickly through these halls. There are now more than 130 healthcare workers under quarantine. 4 patients have died, and dozens of elective surgeries have had to be postponed.
I'm not sure that I can say that it's spreading within the hospital. We know that we have more than one outbreak, and we haven't reached any conclusions beyond that.
Alberta is also struggling with testing. At 7 to 10 days, it currently has one of the longest turnaround times for results in the country, which means if Alberta was entering a second wave, it would take about a week to find out. Still, for now, there is cautious optimism that if Albertans stay the course, a slow and steady burn of cases through the fall would mean no businesses would have to close. Heather Urex-West, Global News, Calgary.
The Canada Emergency Response Benefit, the emergency payment to Canadians who lost their jobs because of the pandemic, has now ended, and the Liberal government wants to fast-track a new multi-billion-dollar federal aid package. It's made a deal with the NDP to support it, and that puts off any chance the Trudeau minority government will fall in a confidence vote. But the aid package is still running into tough questions in Parliament. Our chief political correspondent, David Akin, is with me. David, let's start with this Liberal-NDP deal. What are the details, and what does it mean for Canadians?
Well, the crux of the deal is expanding the eligibility of the Canada Recovery Sickness Benefit. And this benefit pays $500 a week for a maximum of 2 one-week periods over the next year. Now, in its original form, the Liberals had a very narrow definition of what it meant to be sick, how you would be eligible for it. And the NDP pushed to broaden that eligibility to include, for example, the immunocompromised or pretty much anybody who's got the sniffles. We want those people to stay at home. And in broadening the eligibility, the NDP believe that millions more Canadians may be able to use this benefit.
When people put their trust in us to fight for them, people are better off because they elected a New Democrat for standing up for them and to fight for them. They can't say the same for Conservatives or the Bloc. They literally got nothing.
David, what about the price tag for this new sickness benefit and for the other new benefits that will replace the CERB?
Yeah, we really don't know the answer to that, Donna, and that's one of the reasons neither the Conservatives nor the Bloc were able to say they would fast-track the bill that contains these benefits. Remember, there's 3. There's the sick leave benefit, one for caregivers, and one for the self-employed. Now, the bill that has all this in it does have a provision that the Liberals will be able to spend up to $17 billion on a whole range of COVID-related items anytime over the next 4 months with very little scrutiny and not much detail. And there is no answer on how much each of these new benefits are going to cost.
One last question, David. Both the official opposition leader Erin O'Toole and the Bloc Québécois leader Yves-François Blanchet have tested positive for COVID-19. How are they doing?
Well, some good news on that front. The Bloc Québécois leader, Blanchet, he's out of quarantine. He gave a press conference today. And as for the Conservative leader, O'Toole, he is still in quarantine, but he's showing no symptoms. And if that continues, he expects to be back in the House Wednesday. Donna?
Okay, David Akin, thanks. California's latest fire emergency coming up. Flames tear through wine country. There's no mercy from the wildfires raging in California. Napa Valley and Sonoma County are being hard hit. Hot, dry gusts known as Diablo winds carried embers into the city of Santa Rosa overnight. That ignited homes. It forced people to flee in the dark. Much of the city and its suburbs are under mandatory evacuation orders. California has already endured some of the biggest fires on record this year. Climate change is driving temperatures to record levels across the state. President Donald Trump has always fiercely guarded his tax returns, refusing to release them, even though every other U.S. president in modern times has done so. Now, the New York Times has obtained some of his tax filings, and they reveal Trump avoided paying federal tax for 10 of the last 15 years, in part because he lost more money than he made. The paper says he's better at playing a business mogul than being one. Jackson Prosco explains what else Trump's returns reveal.
With his secretive finances thrust into the spotlight, President Donald Trump is left insisting he's the wealthy mogul he's always claimed to be.
They treat me very badly.
You have people that in the IRS, they treat me very, very badly.
Years worth of Trump's tax records obtained by the New York Times show how he managed to pay just $750 per year in federal taxes in both 2016 and 2017. He paid nothing in 10 of the previous 15 years. Business losses drove down his taxes, so did potentially questionable tax deductions, like the $70,000 Trump claimed for his own personal hairstyling, and consulting fees allegedly paid to members of his own family.
There are a lot of things in the return that kind of fit the typical profile of someone who is evading their taxes, who is illegally paying too little.
Trump is taking advantage of many of the tax loopholes used by other wealthy Americans. For any other person, the story might end there. But the Times reports the president has $421 million in loans that he personally guaranteed, bills that come due during the next 4 years, what could be Trump's second term in office.
But anytime you have a government employee, certainly at a high level, who owes a lot of money to some unknown entity or entities, that could be some reason to put pressure, some leverage to put pressure on them.
The massive debts and money-losing Trump-branded properties call into question whose interests Trump is serving while in office. Notably, there are no links to Russia exposed by the tax documents, but other foreign governments like Turkey have at times withheld business from Trump's companies or lavished patronage, depending on the status of official relations with the U.S.
Jackson, is this likely to do anything to shake up the presidential election?
Well, Donna, just more than 35 days out from that election, polls show about 90% of eligible voters have already made up their minds about who they're voting for. That other 10% could be persuaded in part by something like this. But remember, Donald Trump has a reputation for being almost Teflon. It was this time at the 2016 election that the Access Hollywood tape dropped. He went on to win the presidency. But Donna, expect this issue to factor big in tomorrow night's first presidential debate.
Okay, Jackson Prosco in Washington, thank you. British fashion label Fred Perry has pulled one of its popular shirt designs in an ongoing effort to distance the brand from the far-right group known as the Proud Boys. The company's black polo shirt with yellow stripes and an embroidered laurel wreath has become a de facto uniform for the Proud Boys. In a statement, Fred Perry says they have absolutely nothing to do with us and we are working with our lawyers to pursue any unlawful use of our brand. The design won't be available in the U.S. or Canada until the company is satisfied there's no longer any association with the Proud Boys, which the FBI labels an extremist group. Still ahead, 51 days of protests. Will France mediate the political crisis in Belarus? French President Emmanuel Macron will meet the opposition leader of Belarus. She's urged him to help intervene in the country's political crisis. People have protested for 51 consecutive days now. Macron arrived in Lithuania today. Svetlana Tikhanovska is in exile there and says she is the only leader elected by the people of Belarus. Alexander Lukashenko claims to have won a landslide victory in August, but Western governments, including Canada, have refused to recognize him as the legitimate winner. The opposition and tens of thousands of citizens say the vote was rigged. France and Lithuania agreed today the European Union must decide on sanctions against Belarus this week. 2 beluga whales are enjoying freedom after years in captivity. Little Gray and Little White were captured as babies, and this is their first swim in ocean water in years. It's a sanctuary off the coast of Iceland. The whales, who are sisters, grew up in concrete tanks at a Shanghai amusement park. They can't swim into the open ocean yet, but are gradually being given more space to explore. They made the arduous 30-hour journey from China in June, traveling on planes, a ferry, and a specially outfitted truck. Next, gearing up the race for Canadian-made medical face masks. Amazon is delivering thousands of new jobs to 2 major Canadian cities. The company is opening and expanding 2 spaces in Toronto and Vancouver, creating over 3,000 new jobs, it says. Most of the positions will be in Vancouver, where a major building expansion is expected to be complete by 2023, and a new Toronto office is expected to be open next summer. A BC company is hoping to kickstart competition for medical-grade masks in this country. You may recall the shortages at the beginning of this pandemic. The anxiety made worse when the American president, Donald Trump, threatened to cut off our American supply. As Robin Gill reports, companies in this country are gearing up for another spike in demand with a made-in-Canada solution.
Vitacor, based in British Columbia, is rolling out N95 respirators. These particular masks are vital for healthcare workers in the midst of the second wave of the pandemic.
We already have shipments going off to healthcare workers right now. Currently, we're producing 1.2 million masks this month. Next month, we will be scaling up so that will be at about 10 million masks per month.
This type of protective gear must filter out 95% of particulates at 85 litres per minute to meet Health Canada standards. Researchers at McMaster University in Ontario helped ensure the products met those national standards.
What we want for Canadian companies is to become like the Canada Goose or the Lululemon, where they have a value addition and that value addition is recognized by the consumers of the product.
The Centre of Excellence in Protective Equipment and Materials is working with about 40 companies at all levels of the mask process. 3M is launching its own facility in Ontario, with production beginning in 2021. Thus, a mask race in Canada.
These are essential needs in case of a pandemic like this, even beyond COVID-19. I think there would be other viral infections that will come on a periodic basis, and therefore we should be prepared for that in Canada.
Vitacor may have a leg up, but it's aware of the competition.
We're just part of one solution that Canada has and the world has in manufacturing these moving forward.
Business aside, medical-grade masks are a critical part of the line of defense for frontline workers as the pandemic enters yet another crucial phase. Robin Gill, Global News, Burnaby, BC.
And that is Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is the village of Caslow, tucked into the mountains in the West Kootenay region of BC. We'd love to see your Canada. Please email it to viewers@globalnational.com. Thanks for watching, and I hope to see you here again tomorrow. Take care of yourselves. Bye-bye.